We're the Dr. Yazdans.
Okay, so I am at my brother's office right now, and I call him the original Dr. Yazdan because he's older than me, and he was obviously working before I was. But anyways, my brother's name is Amir Yazdan. He is a hair transplant surgeon, and he also does like laser hair removal, so basically all things hair. And he has an office very close to mine in Newport Beach, California. And if you guys follow along in my stories, then you will know that I have really suffered from a lot of postpartum hair loss. And you're probably looking at me like, oh my God, she has so much hair. How could she be like suffering from hair loss? But literally I was taking out handfuls and handfuls of hair every single day. And I've gotten so many questions about my PRP treatments with him. So I came to my brother and I was sending him photos of all the hair I was taking out. And he said, come to my office, I'll do the PRP for you. So I came here and I posted it and I shared it in my stories with you guys.
When you guys see her on Instagram looking good, because I didn't let her go bald.
These Rolos.
I had those. I will admit to eating the Rolos.
So he ate the Rolos.
Okay.
You're lucky your sister's a dentist.
Right.
You ate these red vines for sure.
I did, but those are like a few years old. Look at the expiration date on the package.
So he's eating expired red vines.
Yeah, I know I haven't had those for a long time, but
you guys, he's not taken my advice. He still has these delicious high chews and these delicious Rolos in his office. He has way more. I'm just not pulling them all out. That's enough about the candy. Now let's bring my brother on and ask him all the questions about PRP.
We're the Dr. Yazdans.
This has been 2 months. And when do you see full results?
Probably like 4 to 6 months, you start to see full results. But
yeah, I mean, I already have really good results. So I did 4 sessions, but a bunch of people asked questions. Hold on, we need your face. Okay, there we go. You want to tell them what you said earlier, that we have the same nose?
We have the same nose.
So it's gonna open your phone. Okay.
Face ID will work.
I'm gonna answer your guys', well, he's gonna answer your guys' questions.
And I have no idea what she's gonna ask me, so I might not know the answer.
Okay. How many sessions needed for hair growth? And is this a treatment you have to keep up with?
Yes. So I typically, my protocol is 4 treatments in the first year, and then after that I have patients.
Spaced out how far apart?
So
4 treatments, like 4 different sessions, or 4 groups of sessions?
No, 4 different treatments. So you did how many? You did like 3.
4.
Oh, you did 4.
Yeah,
but we accelerated yours because you were freaking out. She was calling me like every day, like my hair is falling.
And sending photos.
Yeah, and I kept saying, okay. So she was showing up at the office every day for a PRP. Generally, though, this regular patient will just do 4 treatments in the first year. I have my own protocol for that, but I kind of front load the treatment so they get a little bit more aggressive therapy in the beginning, and then it slowly starts to taper. And then I have them do 1 to 2 treatments a year after that as a maintenance.
Okay, so there is maintenance involved. I mean, I'm gonna get maintenance like all year long. I did mine 2 weeks apart. And then for someone who has always had thin hair, will it thicken the hair?
Wait, did someone send you these questions?
Yeah.
Oh, really?
People submitted questions and they want you to answer.
Oh, wow, you're that popular?
It's not popular, I'm just being helpful.
Okay, tell me again, what was it?
For someone who has always had thin hair, will it thicken the hair?
That's from Tishy 84?
Don't read people's names.
Oh, sorry. Okay. For someone who has always had thin hair, will it thicken hair? If you've always had thin hair, it's not going to just thicken your hair. PRP is not magic. It's not one of these things that, you're going to do and all of a sudden, it's going to magically make your hair appear. If you've always had thin hair, you're always going to have thin hair. It will help slow it down from getting thinner, but it's not going to miraculously reverse your, always thin hair.
But basically it turns your hair follicle cycle on, right?
It does, but if you always had thin, it's like I've always been short, can I drink milk and grow? Well, no, like you've just always been short. That's just what it is. Not gonna grow, you're gonna stay short. The hair's the same. If it's always thin, it's going to get thinner as you age. So we can slow that down, but you're not gonna all of a sudden take thin hair that is genetically predetermined to be thin and change that and make it much thicker.
Okay. Fair enough. Okay, so let's talk about what PRP actually is, because somebody said, is it your own blood injected back to you? And the answer is yes. They take your blood and then they spin it down and then they extract. What do they extract?
So the thing with PRP is...
Fast, we don't have all day for this
we don't
video.
have all days. Okay, so how much time do we have?
I mean, the video can't be longer than like 10 minutes.
Okay, so we're already 4 minutes in. So Essentially with PRP, we're taking portions of the plasma that's really high in growth factors and healing proteins, and we're re-injecting back through the scalp. But with that being said, there's a lot of places that do PRP, but generally they have no idea what they're actually really doing, and they're just doing something to sell you something. I get a lot of patients who show up that are very skeptical. They're like, oh, I had PRP for somewhere and it didn't work, or I lost hair, I did PRP and all my hair fell out. And why is yours different? Well, I've spent 10 years trying to figure out how to do this over thousands of patients, and I've figured out the recipe. I mean, it's really a recipe and a formula as to how this is made and how it's done. It's the RPMs that you spin it at, how many times you spin it at, how much you take and extract each time, down to how it's injected, and then also what I add to it. I add a product called Acell to the PRP, which the way I tell patients, it's additional growth factors that makes the PRP a little bit more effective.
Okay, I love all that information. I think it's really important to understand that as professionals, like he specializes in this. This is what he does all day long. So he has the knowledge and understanding of what goes behind it, and he's figured out like all the tricks that he needs to do to get his patients the best results. That's why you should always go to someone who is very, very well educated and experienced in their field for any treatment that you're having. I'll say that for me, my hair grew back so quickly, and I'm very thankful for him and very happy about that, because it's kind of embarrassing to walk around with like bald spots on your head when you're in your young to mid 30s. So
yeah, at first she was like, it's coming back gray. What do I do? I told her to take a Sharpie and just color it. But I told her it'll come back black. Just give it a little bit of time.
Yeah, most of it is. Yeah. Some of it, it's okay. That's genetic. Okay, so this is an interesting question. Is PRP as effective as a hair transplant? So they're totally separate, but I'm going to let you answer the question.
I mean, no, a hair transplant is going to be more effective. That's actually moving hair from the back of the scalp or other areas of the body into the scalp. You're actually moving hair into areas where it's thinned. PRP is good for patients who have just recently lost hair, or they are losing hair and they're thinning and they want to slow that down. It's not going to be good for someone who's like lost hair 10 years ago. It's not going to bring back dead follicles. So yeah, it's
so like if I came to you and my hair fell, it didn't grow back, and I came to you 5 years from now, it wouldn't.
It would not. Okay. Yeah, you wouldn't get the results you had now.
Okay, very important to know. One more thing I was going to say about my hair loss experiences. Mine was postpartum, but I think it works for anyone who's been losing hair lately, like age related, or we get questions about menopausal women.
Right. So it works for menopausal women, age related, younger guys losing hair, postpartum, all that stuff. And, you can kind of make the argument where your postpartum hair loss might have come back without PRP. And it would have. So like all of your result is not just purely from PRP. Some of it was naturally going to come back, but some of it wasn't. And some of it was going to be permanent had she have not, had an older brother like me to save her hair. I said that with a straight face.
Okay, we kind of already answered a lot of these questions with all the great information you're giving. Hold on, there's more though. Okay, this is a good one. Can you have it done for eyebrow hair?
It's not going to bring back eyebrow hair. I just do transplants for eyebrow hair. That or Latisse. Latisse will work pretty good for eyebrow hair. PRP, it's expensive for eyebrow hair. By the time you do a package, it's the same price as a transplant.
Would it hurt for eyebrow hair?
No, it's not going to make it worse.
No, hurt. Like painful.
Well, it stings a bit, yeah. Okay. I mean, it's not going to feel good, but at the cost you're going to spend to do PRP in the eyebrows, you just do a transplant.
Okay, so I said my pain level was like 4 or 5 in the back of my head. What would you say your average patient's pain level is for the treatment?
So like she said it was a 7.
In the front, just right here.
Like a 7 generally is like if you break your leg. So I'm not sure.
I think break your leg is 10 out of 10.
No, that's like getting shot. Like if I shoot you.
Okay, well we are on different levels
10,
of
right?
pain.
So you fall out of a helicopter, that might be like 10.
Okay.
But like generally patients will say like, especially women don't, they're a little more tough than the guys. But it's not really painful. It's a small burn, a little sting where you do the injection. Some doctors like to numb you up before The
I think
PRP,
the numbing would be more painful.
the numbing hurts more. I don't. By the time I'm done numbing you, I'm done with the PRP. The pain level's the same. It's not a painful procedure. I don't have patients complaining of pain.
Okay, let's talk about age ranges to do it in. Like, would you do teens, 20s, 30s, 40s?
You know,
50s?
late teens, like 18, 19, you know, not like a 15-year-old or a 14-year-old, and they're not losing hair anyways. But if you're like 18, 19 and you're starting to lose hair, PRP is good, but it's expensive for a teenager. Obviously, like parents are usually helping pay for that. You know, late 20s, early 30s, you still have hair, it's thinning, you're starting to lose it. That's a good time for PRP. If you're 60 and you've lost a lot of hair, PRP is not going to bring your hair back. You know, we do a transplant.
So how do you find the best doctor to do it at? Like, let's say somebody can't come to you, they're in a different
It's
state.
pretty hard. I don't know.
Like, what should they look for?
You know, you want to look for someone that just does this. They're not like a dermatologist that's selling PRP, like, you know, alongside a menu of other things, or, you know, a plastic surgeon's office or something. You want to go to like a hair transplant specialist, someone that does this all day long. You know, I do like 30 to 40 PRPs a week. So and I have a large patient base, and I've been doing it now like 10 years. I mean, I was on TV 8 years ago talking about PRP for hair loss before anybody was,
true.
And nobody was doing it then. I was like, hey, this will work for hair.
Yeah.
So I started playing with it and trying it, but it's all about the recipe. And, you know, to get that recipe down, it's a lot of trial and error and a lot of work before you figure it out. Like these results didn't come overnight. They came from me, you know, really, 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 really doing this a lot to figure it out.
People wanted to ask if I took any medications like spironolactone with it. No,
So
I
you didn't.
I
mean,
take
you only use
anything.
Grow MD, right?
Yes.
So that was.
I didn't take any medication or anything.
Yeah, no, I didn't prescribe her anything. All we did was PRP, and I had her use the Grow MD as well.
It took about 2 weeks, but I also noticed like my hair in general stopped falling out. So that's a big thing too, because it stops your hair from falling out and then helps you.
Yeah, so her
grow.
hair was shedding like
It
crazy.
was
I mean,
bad.
she was sending me pictures like nightly of her hair and freaking out. And I kept telling her, just relax, it will slow down. It takes time, hair is slow, but you know, overall her shedding slowed down significantly, and the regrowth has now started.
Okay, can you dye your hair while doing PRP?
Absolutely, yeah. This has nothing to do with dyeing.
Okay.
Someone wrote you, "Hi, Dr. Yazdan,"
Yeah.
with the smiley face.
Yeah, people want to say hi.
I thought they were asking questions about
They are.
PRP.
Most of them are.
Okay.
I think that pretty much covers it. So if you guys have more questions, leave comments below this video and maybe we could get him to answer them.
I'm pretty busy. We'll see.